Reading between the lines, it looks like Pfizer will be slightly delayed. Is this still a bit of a question around how much it will be delayed?
Yeah. Hi, Tom. Yes. I mean, I don't have the inside information exactly on when we'll receive this vaccine, but we've seen both in the European Union and the United States delays in rolling out the Pfizer vaccine. We're a small country. We've only ordered 5 million doses. So I'm confident that we will indeed receive the vaccine by the end of February. And then, of course, there's a lot of logistics with this vaccine that may be challenging in rolling it out. It has to be kept at minus 70 Celsius. So your average GP doesn't have a freezer that cold. So there will be regional storage and distribution centres. I don't know the exact details, but I think they'll be scattered throughout the country.
So how does it actually work? I mean, Australia has I think 10 million doses, so 5 million people would be inoculated. A whole host of other countries have contracts as well. If there's an issue, can Pfizer decide what to do? I mean, if you look at it from a world point of view, why would they necessarily prioritise Australia, almost no COVID in the country, over some of the countries experiencing emergencies right now?
It's a good question. And they know that we're in a very safe space at the moment, they being Pfizer. We probably don't have any local cases in the community. So unlike Israel's paid 50% more than the standard price for the Pfizer vaccine. But Israel, a small contained country, is reporting 8,000 to 9,000 new cases a day. So that's in a very different category. Sticking with Israel, Israel has agreed to share all their data with Pfizer. Now, they've already studied the safety in pregnant women and they have approved the vaccine in pregnant women. They're the first country to do so. So we will learn from the experiences of Israel. The United Arab Emirates is the other country leading the race to vaccinate their populations. The other thing we need to know is its safety in children. As of today, the Therapeutic Goods Administration has only advised the vaccine be used in people over the age of 16. So that kind of leaves out almost 20% of our population.
Is that an ongoing question? Because, yes, we know COVID initially, all the assessments were it essentially didn't harm children. They weren't really spreaders. We've got these new strains coming on board as well. Is that a watching brief? Are we going to hear more about whether or not this should be given to children?
Well, there's two parts to that answer. The first is what we know from the clinical trials is that all these vaccines, there's now 7 of them approved by at least one country in the world, are safe and they prevent symptomatic disease and severe disease. So that's great. But we don't know yet whether it will prevent transmission of the virus from person to person. Now, back to children, in general, they don't get severe illness, but they can transmit it. And that was demonstrated in Israel at the beginning of their second wave, which was fueled by transmission in high schools. And then it spread to their teachers, their families, their grandparents, and then throughout the country. So certainly children can spread the disease, but they're not in that category of being vulnerable to severe disease. So it does make sense to wait, be cautious, make sure the vaccine is safe in children. And all the vaccine companies are now looking at the group between 12 and 16. They don't want to start with toddlers. It might be a bit too risky. So they're starting with 12 to 16-year-olds. So maybe by July, we will know that these vaccines are safe in those early high school children.
It is an important question, though, isn't it? I mean, look at Australia. We don't have a rollout scheduled for children because of, so far, the very, very low risk of them getting ill. But if we look down the track and other strains being here, this has been the one group that struggles to do the version of work from home. Young children just don't engage as much. If they're at home, parents at home, the whole economy grinds to a halt. So it's important they can congregate in these close groups, which again is what we're not supposed to do in COVID.
That's correct, Tom. And the other issue is the much talked about herd immunity. Now, I prefer the term population immunity because, well, we're not cows. Now, just imagine we had a vaccine available that's 100% effective. Then if you take away that 20% of children under 16, that leaves us 80%. The latest survey by the World Economic Forum found that 25% of Australians either definitely or probably won't get vaccinated. So that brings us down to 60% of the population. That's if all of those other people get vaccinated. So that's just barely the threshold for population. Because we don't have a 100% effective vaccine. It'll average out with the two, Pfizer and AstraZeneca, at about 80. So we can't achieve population immunity this year. We may do so next year because, look, there are other vaccines on the horizon, potentially very good vaccines such as Novavax. And Novavax will probably release its data on clinical trials within a month. And Australia has ordered 50 million doses of that vaccine. That's enough for 25 million people, which is our population. So, you know, if I talk to you in 3 or 4 months, I might be saying very different things. I'm being cautious at the moment based on what we know about the current vaccines.